Thank you, Diedert. Thank you, Diedert, for the kind introduction, and thanks all for joining today's webinar. Before I jump into the topic, I would like to quickly recap the rationale behind the MICAT project, what are its specific aims, and the general approach of it. So, historically speaking, the concept of quantifying multiple impacts has gained momentum with the publication of a seminal report by the International Energy Agency in 2015. And it aims to make the full set of advantages of energy efficiency policy measures visible and tangible in monetary terms, and thus enable a more comprehensive cost-benefit analysis of different policy options. In addition, it helps policymakers to make informed choices and has also increasingly been implemented or included in the pertinent EU legislation, where it is explicitly mentioned now and also requires member states to report on the multiple impacts in their national energy and climate plans. However, on the other hand, many member states don't have the capacities to do full-fledged modelings of multiple impacts, and this is where the MICAT project is basically started. So what it aims is to address this need by developing a comprehensive approach to quantify the multiple impacts of energy efficiency and make it accessible to a broad audience of stakeholders via an easily usable and free online tool, the MICAT tool. It builds on work of successor projects such as COMBI and MBEE projects. And in the course of the project, the team has further refined and adapted existing methodologies, but also developed new methodologies to improve the scientific knowledge and to match them to the requirements of a combined online tool. In essence, the tool aims to facilitate the assessment of multiple impacts at different governance levels and allows users to quantify and monetize impacts of existing or own customized scenarios and policy measures in 3 different categories: social, economic, and environmental. So this slide shows the general approach of MICAT with the quantification chain at the core of it. So users are asked to provide some input data, mostly consisting of the energy savings and investment costs for specific actions or within scenarios, and differentiated by country, energy carrier, or sector and measure type. The tool then estimates based on these inputs first the impacts in physical units using impact factors and functions that are derived from literature or bespoke modeling. And in a second step, then monetizes these impacts using, again, factors of functions, and only, of course, where is it possible. And in a last step, then aggregates these monetized impacts to allow for a comprehensive cost-benefit analysis, providing users then with different CBA indicators or marginal abatement curves and so on, so that in the end, users are enabled to make informed comparison between different policy options or scenarios. So in today's webinar, we will take a look at the social impacts of energy efficiency in MICAT. The tool quantifies impacts in 3 different subcategories. First, energy poverty alleviation, where the indicator is number of persons lifted from energy poverty. Secondly, the tool quantifies impacts regarding the improvements in welfare stemming from energy efficiency improvements. And the indicator used here is the change in the share of consumption of non-energy goods in income differentiated by income quintile. And lastly, with view to the social impact category, we look at health impacts from energy efficiency improvement. On the one hand, due to improved indoor climate following building renovation activities, and looking at the indicators avoided asthma cases and avoided premature deaths due to indoor cold. And on the other hand, health impacts due to reduced air pollution, and with the indicators here being change in morbidity or avoided premature death. So due to time limitations, we cannot go into detail to all indicators, but today we'll take a deeper dive into the approach for quantifying impacts regarding energy poverty alleviation, which I will present. And then later on, I will hand you over to Fabian, who will talk about the health impacts due to reduced air pollution. So why are we talking about energy poverty impacts and to quantify them? Looking at the most common indicators in the EU, there have been substantial improvements over the last 10 years. Nevertheless, there's still 7% of the EU population, translating into 30 million people around about, that were unable to heat their home adequately in 2021. And a similar number of people had arrears on the utility bills. And if we further look at those with the lowest income, we can also see that their share of housing costs and income is as high as 40% on EU average. In some countries, this number even goes up to 60 or 70%, such as in Denmark and Greece. So needless to say that the precarious situation of these households has been further worsened due to the recent energy price developments, which you can see on the right side of the graph, showing the development in the last 8 years. And at the same time, what we can see is that rents are increasing a lot, especially in urban areas, and we have overall inflation effects, further putting a financial burden on these households. So government in the EU have taken action within the energy crisis to support households with increasing costs. But what we can also observe is that a lot of these policy responses have been non-targeted and often take on the form of income support or energy subsidies. Clearly, for low-income households, this is a very relevant help and is needed to support them to get through the crisis. But in this non-targeted broad form, it is unsustainable from a public budget perspective and also in contradiction with climate policy that is introduced at the same time, like the CO2 taxation or the planned introduction of the emission trading system in the residential and transport sector. So instead, what is necessary to fulfill the promise of a just transition in the EU is more targeted action to improve the energy efficiency in vulnerable households and permanently decrease their costs for access to the basic energy services. If we look at the political agenda in the EU, energy poverty has been on it since as early as 2011, which has led most visibly to the setup of the Energy Poverty Observatory in 2018 as a central hub of energy poverty related information, which was then followed by the setup of the Energy Poverty Advisory Hub in 2021, which is looking more at providing technical support to stakeholders taking action against energy poverty. In terms of legislation, the increasing political relevance is also reflected that by now in all energy-related directives, energy poverty is mentioned and requirements are set towards the member states, ranging from requirements to define energy poverty, to assess it, to set targets and policies, achieve shares of savings, but also report on these aspects in their national energy and climate plans. So what we see is that particularly with view to this requirement of reporting these impacts, this is where a MICAT tool can support member states with limited resources or capacities in the reporting by providing indicative results of energy efficiency actions. It can also provide indications on how policy design affects energy poverty impacts. So I will go into this a little bit more later down the line. What it cannot do, of course, is to replace detailed modeling of energy poverty impacts with more specific data. Since MICAT is taking on an indicator-based approach, the first thing to decide was how we define energy poverty in the project, in the tool, and consequently what indicators we will use for quantifying the impacts. As you might know, there is a variety of definitions and supporting metrics in the EU that reflect the respective national debates or policy frameworks. However, due to these differences, as of now, there's no commonly agreed definition or a uniform set of indicators that are applied in all member states. Nevertheless, in its recent recast of the Energy Efficiency Directive, the Commission has provided a broad definition of energy poverty, which emphasizes the lack of access to essential energy services at basic levels, without further specifying this level in absolute or relative terms. In addition, it has provided a recommendation on energy poverty with a list of different energy poverty indicators that can be used to assess energy poverty in the member states, which you can see listed here in the table on the right side. These can be categorized into consensual indicators on the one hand and expenditure-based indicators on the other. Looking at the first group of indicators, they are based on self-assessment of households and use statements on their ability to keep their home adequately warm, whether they had arrears on utility bills or if they live in a dwelling with defects, and use these statements to capture subjective experiences of energy poverty. So this is kind of an advantage of these kinds of indicators. In addition, this is collected on a very regular basis in the annual survey on income and living conditions. On the downside, they tend to have the risk of possible underreporting if households feel ashamed to report on their situation. And more significantly, they're not very nuanced. So there's no differentiation of different levels of energy poverty, but they're only binary indicators. So looking at the other side, the expenditure-based households, they are looking at absolute or relative energy expenditure and compare these to a national threshold to define energy households as energy poor. So here we have the M2 indicator, which is defining energy households as energy poor in case their absolute energy expenditure is below half the national median. And on the other end of the spectrum, trying to capture households with a very high financial burden related to energy expenditure, the 2M defines households as energy poor if their share of energy expenditure in income is more than twice the national median. So the downside here being that these are based on the household budget surveys, which are not collected in a regular manner and are not regulated by the EU. So we, as a scientist, we only have access to these, to the data in 5-year intervals. And one could also argue that the threshold of defining who is energy poor and who is not is to some extent arbitrary. So why households slightly above that line are not energy poor and slightly below is. So this is more of a decision to be made. But with regard to what we are trying to do to estimate impacts, there's one very big advantage here, that it allows to assess the severity of energy poverty by defining a monetary value. So meaning that how far are households away from these threshold values, which we call the energy poverty gap, and I will talk more about that. So in effect, this is also the reason why we decided to go with these kinds of indicators in the MICAT tool. So like I said, these are the two indicators capturing underspending on the one hand or overspending relative to the income on the other hand. So what the tool can do is to estimate impacts of both building and household targeted energy efficiency improvement actions. So with building targeted actions, we mean, of course, renovations and so on, something that that covers the whole building, whereas household targeted actions can be related to appliance replacement or behavioral actions. If we look at building renovations, we differentiate between tenants and owners due to the fact that they are differently affected in financial terms by a renovation. So the flow of money or a burden is different, whether you're an owner-occupier or a tenant. And the basic idea behind the approach, how we estimate the impact, is that we look at yearly household energy cost savings due to energy efficiency improvement and adjust these with view to the investment costs or the rent increase in case there are tenants. And then based on the net energy cost savings, we compare them with the distance of a household's energy expenditure to a threshold value. So we look whether the energy cost savings are sufficient to bridge the energy poverty gap. So to exemplify, I included here an exemplary distribution of household energy expenditure on the left. This is based on data for Austria. And you can see here the energy poverty threshold, which is half the national median value. So all households on the left side of this threshold are considered energy poor. So what we do effectively in the tool is to look at the net energy cost savings and whether they are sufficient to move these households beyond the threshold, meaning they can increase their energy expenditure to a level beyond this threshold. So in order to use the tool, users are asked to provide some information on the energy efficiency policy or scenario they want to estimate the impact for. And at a minimum, what is needed is the final energy savings by energy efficiency improvement action type. Then the investment costs that go along with that. And particularly when building renovations should be modeled, the number of induced energy efficiency actions need to be provided to get an idea how many households are affected by a measure. If to receive more precise estimates, additional information on the energy efficiency measure or scenario can be provided. For one, the share of actions to be implemented in energy poor households. So thinking about a policy, this could be there's a specific target within the formulation of the policy. Then furthermore, subsidy rates can be included to indicate how the financial burden of implementing these measures is lowered due to funding or financing by the state. And lastly, since we want to adjust the energy cost savings by potential rent increases, also a renovation rent premium can be inserted as a share of the original rents of energy poor households. On the other side, in the back end of the tool, there is a variety of data that is used for implementing the calculation steps, comprising data on the building stock, the households by member states, and on the energy efficiency improvement actions in terms of standard energy savings or investment costs. So this slide shows the quantification approach we use in MICAT for estimating energy poverty impacts, which consists of three main steps. First, we define the type and number of energy efficiency actions. This is usually done by the user. And then we calculate, or the tool calculates the net energy cost savings by adjusting the energy cost savings for rent increase and annualized investment. In the second step, the number of energy poor households benefiting from the EEI are determined. So this means the targeting in the policy by means of a targeting factor ranging from 0 to 100%. And the last step, and this is the most relevant one, is to translate the savings into an impact in terms of energy poverty alleviation. To this end, as said before, we compared cost savings with the distance of households' energy, absolute or relative energy expenditure to a threshold value, and then derive an impact factor that tells us what share of the benefiting households are not energy poor due to the savings. To exemplify this a little bit more and to reiterate the two central concepts here, the energy poverty gap is the distance of the household's absolute or relative energy expenditure to a defined energy poverty threshold, which you can see on the right side in this graph at the 0 line. And below, you can see the distance of the households from this energy poverty threshold. So these are the deciles of energy poor households, with the least severely affected on the left hand. So those in the first decile, they have a distance of 11 euros needed to go beyond the threshold. And on the right side, there are those that are most financially burned or don't have sufficient means to increase their energy expenditure. And the distance here is about 700 euros. So the impact factor that we derive then is the share of the households for which the energy cost savings are sufficient to increase or decrease the energy expenditure above or below the threshold value. So if we look at an example of a use case, an energy efficiency policy or program that generates yearly energy cost savings of 600 euros per household in a year, and the tool adjusts these savings for investment costs and rent increase, and 200 euro of net energy cost savings remain. So if we apply that to the distribution of the energy poverty gap, we can see that for some households, the additional energy cost savings are sufficient to enable them to increase their energy expenditure, and for some it isn't. So in effect, in this case, in this example, 50% of households would be lifted from energy poverty, translating into an impact factor of 0.5. And for 50% of benefiting households, these cost savings are still insufficient to lift them from energy poverty. To conclude, I would like to highlight some of the main assumptions behind this approach and also point out some of the methodological limitations. First of all, and most evidently, there is an assumption that this monetary value of energy cost savings, in fact, is sufficient to lift households out of energy poverty or sufficiently reduce their financial burden. This can be argued, and of course, in the future, there will probably be a possibility to adjust these figures. Secondly, when looking at the impact of building renovations, we had to make some simplifying assumptions due to a lack of data, one being that savings are equally distributed to different building types, single, double, and multifamily. And equally, if we look at who is affected by energy renovations in a specific policy, we assume here, for simplicity reasons, a proportional distribution among owner-occupiers and tenants, which is a very strong assumption indeed. And lastly, if we look at the distribution of investment costs and energy cost saving among building occupants, we also assume an equal distribution of these costs due to other possibilities. In terms of the methodological limitations, these are also very closely related to limited data availability, the database for calculating energy poverty gaps and based on the energy expenditure, and also average rents of energy poor households are rather old, and we had to inflate these figures, which may introduce bias. However, we expect with new data being made available to reduce this kind of bias, hopefully in the future. Then, since this is a tool which is not only there for actors on the national levels, but also for subnational level, at the moment, unfortunately, we have very limited data for the subnational level. So as a solution, we use national values as proxies, which may not accurately reflect the situation in different regions or municipalities. And third, what we discovered in the research of the for data for the tool, we found that there's a significant research gap on rent premiums for energy efficiency building improvements. So the solution for the moment being that this is user adjustable. And lastly, a last limitation is that if a user wants to model different energy efficiency actions, such as an appliance replacement program or a building renovation, this is only possible to do if there are equal numbers, since we have to distribute the energy cost savings specifically to households. But this is something probably to be improved in the future. Okay, so this would be it from my side, and I'm looking forward to reading your comments and discuss with you later on, but I will now hand you over to my colleague, Fabian.
Thank you, Florin. My presentation will be probably a lot shorter because Florin already covered the ground of describing the tool again and recapitulating the whole purpose of the exercise. I will be focusing, as Florin said, on the human health impacts, in particular on the human health impacts from air pollution, ambient air pollution, not indoor air pollution. And the reason for focusing on this indicator is because it promises very large benefits. I remember that in a good cost-benefit analysis, you need to weigh costs and benefits, and it's important to figure out what are the main benefits in order to be sure that you're not overlooking anything important. So just to put this into perspective, currently we are still facing the fact that in the EU we have an air pollution problem, even though it goes a little bit unnoticed, and it is being addressed, but we are still seeing more than 200,000 premature deaths as a result of ambient air pollution in Europe. And so, it's, as I said, it's quite natural then to focus on this as an important indicator. In order to describe what we're doing in MICAT, I want to sort of briefly explain and recapitulate how air pollution actually comes about and how this is related to energy efficiency. So the way we'd like to think about ambient air pollution is that this is the result of emissions here on the left-hand side arising from different sources and also implicitly from different pollutants. One of the main health indicators related to air pollution is related to fine particulate matter, which we call PM2.5, very fine particulate matter, which isn't just emitted directly into the atmosphere, but also forms through chemical and physical processes in the atmosphere and results from different precursor substances that are coming from different sectors. So these emissions are then mixing in the atmosphere and they affect ambient air quality. And this air is then breathed in, and then depending on the exposure levels and the vulnerabilities of the populations exposed, lead then to health impacts. And the logic here is that as we are implementing here energy efficiency measures on the left-hand side, this then sort of the benefits of this then run through this causal chain and reduce the impacts of air pollution on the right-hand side as well. So let me focus a little bit more on how this methodology works. in the MICAT tool, the methodology is basically based on the GAINS model. The GAINS model is a model that we have developed here at the International Institute for Applied Systems Analysis. GAINS is an acronym standing for Greenhouse Gas and Air Pollution Interactions and Synergies. It's a well-established tool that has been used by the Commission to develop and to assess various air quality policy proposals. The scenarios that we are studying reflect all the current policies that are in place as a backdrop for future development of legislation. It's a technology-based model that covers hundreds of sectors and technologies that all, technologies for reducing emissions. We have an interface with the PRIMES model, which is, as you know, the sort of the tool of choice of the Commission for developing energy scenarios. The GAINS model covers both air pollutants and the greenhouse gases, and it also includes what we call a reduced form chemical transport model derived from a bigger chemical transport model, which is called EMAP model. This kind of model allows us to translate emissions into air quality and thereby spatially explicitly assess air quality and impact calculations. All right, so what we do then when we are sort of translating this sort of very simple figure into actual assessment action. So what we do is we take in MICAT into account, as Florin already indicated, input by the user of how much energy is going to be saved through a particular measure. And this is then, of course, determining, well, this is dependent, of course, on which sector this is happening, whether it's in transport or in buildings. And we translate this into how many tons or kilograms of emissions are being reduced. Again, this is very sector specific. If you reduce sort of a gigajoule of energy in the industry sector, the resulting emission reductions are different from the reductions in the transportation sector. All of that is reflecting the latest information about technologies and legislation. In the next step, then we use this emission profile and put it into this reduced form model to figure out how does this affect the concentrations of PM2.5, again, spatially explicit at a relatively high resolution. And then in the next step, we overlay this with a population density map, because we know where people live. We can then figure out in the next step which population is being exposed to which concentration levels. And then we use so-called relative risk functions or dose response functions to estimate what will be the health impact from these exposure levels. So we can quantify on the one hand how many people are affected, but also we can then estimate on a statistical basis how many people are likely to die or how many people will have health problems as a result of the air pollution. And if we focus again on the fact that we're here interested in not the absolute effect, but on the reduction effects, we can here estimate how many premature deaths can be avoided, how many hospitalizations can be avoided, how does the overall health of the population benefit from the energy efficiency improvements or energy savings measures. We then have we go to the next step and monetize these benefits, and we've sort of let's focus on what kind of indicators we are actually looking at. I've mentioned already premature deaths, but we're also looking at hospitalizations. There is a well-documented relationship between ambient air quality levels and hospitalizations related to specific diseases like lung cancer and COPD. So we can estimate that effect, and we can also estimate the effect on what this means for productivity in particular, and how many work days people will be lost, and how many times people stay at home, again, as a result of air pollution. Reversing that argument, once you improve air quality, you can reduce all of these indicators. We then take the indicators and their improvements and monetize them. In the upper two cases, we are looking at how much does it actually cost to hospitalize a person, and so how much money could be saved. How many workdays are lost, again, is depending on the average wage. And then for the premature deaths, we're using an approach using the value of statistical life in order to estimate what the associated benefits are. All right, so this covers the main methodology. The main assumptions in our approach is that we're focusing on PM 2.5 as one of the most significant indicators of health impacts from air pollution. So we're focusing on PM 2.5 and its precursors when it comes to emission reductions. We're using a well-established methodology that is consistent not only across member countries, but it's also consistent with the approach that the Commission uses to assess policies. The model is well-established, it's peer-reviewed, and as I said, consistent. The data set that we're using in terms of what kind of technologies are available, what kind of emission factors do these technologies produce, what is the assumption about atmospheric dispersion, and so on and so forth. All of that is consistent with the latest work by the Commission on the Ambient Air Quality Directive and the Clean Air Outlook. Some of these processes are still in process, so as I said, it's then entirely consistent, and it's good to know that this is going on in parallel. And all our future scenarios, as we are sort of speaking about the impacts in future years, all of this is reflecting current policies in this area. There are a few limitations and uncertainties. The uncertainties, the first item is that the user provides input on the energy, or should provide input on the energy that is being saved through various measures. But often that input is not fuel specific. So we may know that through particular measures, the energy consumption for the building stock could be reduced. But at that stage, we don't expect the user to supply how much of different fuel types is being reduced. And that, of course, means that we have a little bit of uncertainty of how much emissions are actually being reduced. So in principle, more detailed information could be covered by the tool. Or the tool could calculate more detailed input. To what extent the user can actually enter that is a little bit of an open question at this stage. There's a couple of other issues that are limiting the validity in minor ways, but really just in minor ways. And that is we have a very good spatial distribution pattern at the moment, in that we know where different emission sources are located. And this may change over time or into the future. So in order to really figure out how many people are exposed at a particular location, this could be taken into account. And then finally, as you may have seen on the previous slide, sort of the empirical dose response functions that have been estimated are non-linear, and they suggest that at higher concentrations, the benefit of reducing concentrations is not as high as at low concentration levels. So what we have done is we have linearized these functions, and that is acceptable. I think experts agree that this is a good way of doing this, but it also means that it's not so straightforward to scale down to the city level, because the city is not just sort of, it doesn't look like in this kind of analysis, the city doesn't look like just a small country, but a city has some heterogeneity, spatial heterogeneity. People live in a much sort of much more densely populated areas. And therefore, downscaling the results of the tool to the city level is not such a straightforward exercise. But overall, these limitations and uncertainties are very well under control at the national level and at the EU level. And so we are confident that the results are consistent and robust. And with that, I guess I hand back to Diedert